Okay. Uh, one more of my infamous YouTube videos coming up. Um, Probably only a few friends have seen the others. It will probably be the case with this too, but that's all right. Uh, I'll send it to a few others. The subject again deals with systemic racism versus individual racism. Um, they're not they're not the same, and I belong to the team that believes that it's not that there isn't any systemic racism anywhere, but that is not the major problem in most places. The major problem is racism, but it is individuals and not the system. All right, let's go back and tell you what got me on this kick again. I heard a very nice talk by Jennifer Carroll Foy, who's one of the Democratic contenders for governor in Virginia. And I'll start out by saying she's a very intelligent woman. She's a passionate woman, and it's quite possible I would vote for her if I lived in Virginia. Uh, However, I take issue with some of the tales she told that supposedly represent systemic racism. And it involves with the difference in medical care between pregnant black women and pregnant white women. Let's start out with uh, uh, a fact which is it cannot be it cannot be denied. I'm trying to think of the right word. It wasn't the one, but that'll do. Okay. The fact is that the infant and mother mortality of pregnant black women is far greater than that of white women. Okay. To those who believe in systemic racism, almost as a religion, as I would say it, feel that the only possibility is systemic racism, which is not impossible to produce that result. But let's deal with the fact that Canada and England have the exact same disparity that the United States has. Now, what's the difference between Canada and England and the United States? They have a different system of medical care. They have universal medical care, so that there's nobody that's too poor to get medical care. And you have to explain now how the systemic racism of American medicine gives the exact same result, okay, of nearly a twofold increase in maternal and fetal mortality. The other thing is that if you look at fetal mortality in African nations, it's also very high. And you could blame that on the medical care system, which is not as well developed. But you have to deal with the fact that you're still dealing with a very high mortality in well-developed countries, and even those that have completely socialized medical systems. So it gives you pause. One of the other reasons to pause is that once you decide something is systemic, you stop looking for other causes. And that can be a problem. Let's take a hypothetical case. Supposing that black women genetically have a lower vitamin D level. This happens to be true. Blacks have a lower D level, which is generally thought not to be any problem because that lower amount seems to do what the higher amount in white people. But what if that lower D level was related to fetal and maternal complications of pregnancy? You wouldn't be allowed to even think about it or look at it, that there could be a genetic difference between blacks and whites, And if you're not allowed to look at it, you're not going to find the treatment or the cure. So this rush to systemic racism, I feel, is dangerous. Where it exists, it is truly systemic. Okay, let's go after the system. But it should not be presumed that every disparity is from a systemic problem. And let's tackle it a little more. Our candidate, Ms. Foy, recounted her own experience where she went to an emergency room having a lot of pain. Late in labor, she was seen by the emergency room doctor and sent home. Her analysis: systemic racism. I don't know that she's ever worked in an ER in any capacity. ER doctors live under the most extreme stress of just about any occupation I can think of. Maybe the people who defuse bombs may have more stress in their life, but they don't do that every day. And maybe per episode they may have more stress, but overall they have less stress. The ER doctor is like somebody that has to defuse 100 bombs in one evening, because every patient that comes in, every single one might have a fatal illness, and a large majority of them think they have a fatal illness, even if they've just ate too much or are constipated. So the ER doctor has a very, very difficult job. And I would just like to encourage everybody, including Mrs. Foy, to be a little more sympathetic of that doctor, just as we expect the doctors to be more sympathetic to women and more sympathetic to people of oppressed races and the like. Let's talk about pain. One of the things that is known about pain is that for the same stimulus, women feel more pain than men. They're not making it up. They're not faking. They actually experience more pain. But that means the same conditions which produce non-fatal illness are going to hurt women more than men. And to add to the mix, it's also known that blacks actually feel more pain. There are physiologic studies done. It's not a racist thing. It's just a fact. It's like if you say blacks have darker skin on average than whites, is that racist? No, some people probably would say that it is racist because you don't have to be black to be a black. But the overwhelming majority of black people are more darkly complected. And if it weren't the case, they would be called blacks. So there can be genetic differences which may extend beyond skin color. And actually we know that there are many diseases that have different prevalence based on genetic factors. So in any case, the ER doctor is always faced with a dilemma with pain. And there's always, unfortunately, to be realistic, you have to be a little more careful with women and with blacks because they may be complaining of more pain than somebody else with the same disorder. It doesn't mean it should be ignored. Every patient has to be regarded as somebody who may have a very serious disease, which is what ER doctors do. But it is not automatically racist or sexist to send a patient out with pain. I can't tell you how many lawsuits go against ER doctors. Tremendous number because of the pressure they are under. People come in with pain, the examination seems good, the tests seem good, they're sent home, and then they have a heart attack or a fatal kidney stone, or some other disaster happens, and it turns out that they have widespread cancer that they weren't able to detect, and a lawsuit comes about. ER doctors all live under that threat of lawsuits, and that I would say it 99.9% overpowers concerns of racism. Not to say there aren't racist doctors, there are, but it's not systemic. ER doctors are not taught to ignore the pain of black people or of women. They're to take every patient as seriously as possible. But in the course of doing that, excuse me, they still have to rely on their experience that many people come in with pain where it's not so serious. Um, One of the examples are men who come in with chest pain, and the only reason they came in was because their wives insisted. Men don't like to admit to having pain, even if it's bad. So you have men come in, no, there's nothing wrong with me. My wife just told me to come in, it's just indigestion. And they end up being admitted to monitor the obvious heart attack. On the other hand, women can present with atypical pain, which doesn't sound like a heart attack. They can have pain in their neck, not in the chest, and all sorts of other weird symptoms. So the ER doctor is under tremendous strain. It is a very difficult job to sort out the serious from the non-serious. And it is, I won't accept the explanation that she was sent out of the ER for purely racist reasons when thousands of people, hundreds of thousands of people with pain are sent out of the ER because after the evaluation is done, they don't think they have a life-threatening condition and they don't need to be in the hospital. It's as common as can be. All right, next issue. It might be a little more sympathetic to the doctor. It may not be racism at all, let alone systemic racism. The reality still is that black people, not just Americans, blacks, at least in the United States, Canada, and England, have a higher rate of serious complications. Now, there can be racist roots to things which are not racist, and this gets tricky. For example, blacks do not trust doctors. And there's good reason in the past for that, and there's also cultural and other reasons for not trusting. So many women who are pregnant see the doctor for the first time when they come to the emergency room to deliver the baby, and they're already suffering a life-threatening complication on their first visit, which could have been handled safely, easily before. Now you can say, well, but black women aren't insured, but this applies whether they have insurance or not have insurance. And as we pointed out earlier, the same problem exists in countries where everybody is insured. The same exact thing happens in terms of the outcome. So many black women do not see a doctor. They have complications that are treatable. They come to the hospital and it's already full-blown too late, and they end up losing the baby. They may end up losing their life. They may end up losing both. And who are you going to blame? Okay, you can blame, quote, the system. To me, it doesn't lead to anything. The problem is you have to get to black women. You have to educate them that pregnancy is a potentially serious, I don't want to call it disorder. It's a serious state which can have many complications, many of which can be prevented with regular OB care. So the fault may not be with the medical system, it may be with our schools. All girls should be taught that OB care has to start as soon as they know they are pregnant and continue regularly throughout the pregnancy. So the causes for the increased complication in blacks is very complex. There are genetic factors, there are social factors, and there are undoubtedly some episodes of racism. But the racism that occurs are from racist individuals, not a racist system. I have personally never met a racist ER doctor. I'm sure there are some, there have to be some, just statistically, there have to be some. But the doctors I know and the doctors I see, they generally work themselves very hard to help every patient, regardless of their color or gender. And if they make a mistake, it's from a personal bias, not a systemic bias. There's no rule that says obstetricians will see blacks less frequently than whites. There's no rule that says black people are only allowed one visit to the obstetrician during a pregnancy. So, all right. In any case, you've heard my harangue. If you live in Virginia, you might look up Jennifer Carol Foy. She looks like a very intelligent person. I know she can't run with the kind of stories that I'm telling now. These are not stories in the sense of things that are true. These are true life stories. Politicians have trouble if they start being nuanced that, well, maybe it was racist and maybe it wasn't racist. Nobody will vote for them. They have to come out and strongly say that, if they're a Democrat, they have to say that it definitely was racist, and if they're a Republican, they have to say it definitely wasn't racist, when the reality is it's much more complex than either of those extremes. There are so many factors involved in why black women specifically have increased morbidity and mortality in pregnancy. And to find out, we have to look at every factor, including what might be genetic, what might be cultural. And some of this, the black community should take the responsibility for educating people in their community. There's no reason why that cannot be done. The churches would be a good place just to start. All right, you've heard my harangue. God willing, our children will have a less racist future, whether you call it systemic or individual. I would contend that they will, because in spite of the naysayers, the fact that we have black governors, that we've had a black president, we have a black vice president, these were unthinkable things, totally unthinkable during the majority of my life. Okay, this would not have happened in 1950, 1960, 1970, in fact, 19 anything. This would have had to occur after 2000 and maybe after 2005 or 2010. We are making progress. We're going to make more progress. We will never eliminate racism totally. Racism is universal. People sort themselves into tribes. You look at what's happening in Nigeria, the slaughter of Christians in the hundreds and the thousands, including children. Okay, this is, you can say it's religious, but religion is the same hatred that goes into racist It's still bigotry. It's terrible. I don't think we'll ever get rid of 100%. But let's start and shoot for getting rid of 50% of what we have now. That'll be good progress, and then we'll work on the next 50% of that. I don't think we'll ever get rid of 100%, but we should try. We should try. But I think we have to be honest and not just say it's systemic, in which case you throw up your hands because there's nothing that you personally can do, when there really is a hell of a lot that individuals can do to lower morbidity and mortality for Black mothers and Black babies. And it starts with getting them to trust, it may be hard, the medical system, and at least go to the obstetrician and go early and go often, and don't show up in the emergency room without having an obstetrician getting ready to deliver. Okay, it's night here. I don't know what time you're looking at it, but I want to wish everybody a good night. Wish that we all have a less racist world in our future. Amen.